Hello, my name is Leona Dixon, and I am here to do a head-to-toe assessment for my family nurse practitioner program with the University of Memphis. Today's date is Wednesday, January 10th, 2024, and the time is 6:16 p.m. We're going to start off by scanning the room. I'll take this out. And then the ceiling. And then the floor. And then we just have our material here. I'll put this back in here now. All right, do I got that still? There we go. All right, now we're going to start off by washing our hands, and we're going to assess the skin of the head, face, neck, posterior chest wall, anterior chest wall, and the abdominal area. Also our upper and lower extremities bilaterally for color, moisture, tugger, texture, edema, temperature, nevi, lesions, bruising and scarring. Then we're going to assess the head for position, midline position, symmetry, and shape. Now we are going to inspect and palpate the head and scalp for hair color, texture, distribution, for any masses or tenderness, any depressions or infestations. Next, we will move on to palpate the temporal arteries for any tenderness. Now we're going to palpate the head and neck lymph nodes. We have our pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclaviculars. Next, we're going to palpate for TMJ for crepitus, subluxation, and tenderness, open and close. Thank you. While we're here, we're going to assess cranial nerves 5, the masseter muscle. It's also known as the trigeminal nerve, so just clench down for me. Okay. And also part of cranial nerves 5 is light touch or sensory. Where am I at?
Forehead, nose, chin, cheek.
All right. Next, we're going to assess cranial nerves 7, which is the facial symmetry nerve. So can you smile, frown, puck your cheeks out, like pucker your lips, raise your eyebrows? All right. Next, we're going to move on to the ear portion of the exam, where we will be inspecting for shape and position, and we're going to palpate the penes and the tragus for any masses or tenderness. Next, we will go in with our otoscope, and we're going to be inspecting his tympanic membrane and auditorial canal. And the tympanic membrane is pearly gray and translucent, and on the right side, the light of cone is at 5 o'clock. Same on the left. The tympanic membrane is pearly gray and translucent, and the light of cone is at 7 o'clock. Next, we'll be assessing cranial nerve 8, which is our auditorial nerve for hearing. We will do that with the whisper test. So can you plug this here? 1, 2, 3.
1, 2, 3.
Other ear. ABC.
ABC.
And then we will assess it with the Weber for lateralization. Hear equally in both ears.
Yes, ma'am.
Now we're going to do the Rena. We'll replace it on the mastoid bone. You hear it?
Yes.
Tell me when it stops. Same on the other side.
Yes.
And when it stops. Okay. Next, we are going to move on to the eye portion of the exam. We'll be inspecting the lashes, the brows, the palpebral fissures, the sclera, and the conjunctiva for any discharge, color, or lesions. Look down, look up. Oops, sorry. Look up. Thank you. Now we're going to assess cranial nerves 2, which is our optic nerve, and it is going to assess gross acuity vision, and then peripheral and central. So first we're gonna do peripheral and central. Tell me when I'm coming into your fields.
Yeah.
And then into your fields.
Yeah.
Okay. And then the next one, we'll be doing it with the Snellen's chart for gross acuity. Can you cover one eye and read the lowest line?
EPTZO.
Cover the other.
EPTZO.
Open both.
EPTZO.
He is reading at 20 out of 30. Next we will do cranial nerve 3, where we will assess his pupil response, direct and consensual. And cranial nerve 3 is the ocular motor. So we're going to start with direct. Keep your eyes open and look behind me, please. They constrict directly. Now we're going to flash a light and look in the other one. And then we're going to look in the opposite one. And they constrict consensual. Now we're going to do accommodation and conversion. So I'm going to have you just follow this in with your eyes only. Back out. Look behind me. Back at it. Good. Next, we're going to be inspecting for conjugal gaze with EOMs, which is cranial nerves 3, 4, and 6. So that will be the ocular motor, the trochlear nerve, and the abducent. So I'm going to have you just follow with your eyes to my finger. Okay. Alright, now we're going to be inspecting internal eye structures with our ophthalmoscope and for a red light reflex. I'm just going to look straight out. Red light reflex is present. Internal eye structures, veins are greater than arteries. And then the other side, we'll have you kind of turn so you can see. Alright. Open your eye. Red light reflex is present. Internal eye structures is greater than, veins are greater than arteries there. Now we're going to move on to the nose portion of this exam, where we are looking for size, midline position, and symmetry. We're going to assess for cranial nerves 1, the olfactory, which is sense of smell. Can you close your eyes? Tell me what you smell.
Alcohol.
Okay. Tell me what you smell now.
Coffee.
Okay. You can open your eyes. Now we're going to assess for nasal patency, where you will plug one nostril and blow. Plug the other one and blow. And now we will palpate the frontal and maxillary sinuses for tenderness. Next, we're going to be assessing the mouth, where we will be inspecting the lips, teeth, gums, buccal mucosals, the tongue, the soft palate, the floor of the tongue, the posterior pharynx, the salivatory ducts, and the tonsils. Can you open your mouth for me, please? Alright, now we're going to assess cranial nerves 9 and 10, which is the vagus and the glottopharyngeal nerve. So just stick your tongue out, say ah. The soft palate and uvula rose on phonotation. Now we're going to assess cranial nerves 12, the hypoglottis nerve, where the patient will stick his tongue out and move it from side to side, touch your tongue, nose, and then back in. No. The tongue is midline without fasciculations. Now we're going to move on to the neck portion of this exam, where we will palpate the trachea and look for midline position. I'm going to have you kind of turn the camera a little bit. I'm going to come behind the patient. We're going to assess for the thyroid. We're going to displace it and have the patient swallow while we palpate. Again, swallow while we palpate for any nodules or tenderness. Next, we are going to move on to the respiratory portion of this exam. We're going to be inspecting the patient anteriorly and posteriorly for any signs of obvious deformities and symmetry. Also going to be looking for respiratory distress, which will be use of accessory muscles, tripod positioning, nasal flaring, retractions, tachypnea, and cyanosis. Might have you turn around. we're going to start on the posterior chest wall for the respiratory. And we will start by doing chest expansion for symmetry. Can you take a deep breath in? All right, can you kind of just angle a little bit? Thank you. And now we are going to palpate for tactile foramus, say 99.
99, 99, 99, 99, 99.
All right, now we are going to percuss over each intercostal space. Now we are going to auscultate for breath sounds over each space. Now we're going to do egophony with the patient saying E every time I move.
E, 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 E.
Now bronchophony, every time I move, you'll say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
All right, and then next we'll do whisper petriquility with the patient whispering 1, 2, 3. All right, now we're going to have the patient turn around so we can inspect the anterior chest wall again for any obvious deformities, symmetry, and the respiratory distress, which will be your use of accessory muscles, retraction, nasal flaring, tripod positioning, cyanosis, or any tachypnea. First, we're going to start off by also palpating for chest expansion symmetrically. Take a deep breath in. All right. Now we're going to palpate for tactile foramus. Can you say 99?
99, 99, 99, 99.
Now we're going to auscultate for breath sounds. Raise your arms up for those lateral lung fields. All right, now we're going to move on to the cardiac cycle of this exam, where we're going to be auscultating each portion of the heart with our diaphragm and our bell. To our right sternum border in the second intercostal space with our diaphragm, we're going to have our aorta. To the left side of the sternum border on the second intercostal space, we have our pulmonic. Our third will be herbs. Our fourth is tricuspis. And then to the fifth midclavicular line, we have our mitral valve. We'll flip it over and we will be doing with our bell. We have our aorta, pulmonic, herbs, tricuspis, mitral valve. Now we are going to palpate for PMI, which will be at the midclavicular line of the fifth intercostal space. And then we will go back with our diaphragm and we will listen to our mitral valve for an apical pulse, which will be at our mid-clavicular line at the fifth intercostal space, where we will hold for one solid whole minute for rate and rhythm. We'd like to hear an S1, S2, and then rate and rhythm to be between 60 and 100. Now we're going to have the patient lay in a 30 to 45 degree angle. And we're going to be assessing for any jugular vein distension. Can you just put your head one way? All right, and the other way. All right. Now we're also going to be inspecting for any heaves or lifts, and then palpate for any thrills over each five spaces of the heart. We'll start with the aortic, pulmonic, herbs, tricuspis, mitral valve. Now we're going to lay the patient down. Okay. And we are going to repeat the cardiac cycle with our bell and diaphragm again. So right second intercostal space, we have our aortic. Left second intercostal space, we have our pulmonic, and then third is our herbs. Fourth is tricuspis, and then fifth midclavicular line for our mitral valve. We have our bell now, so we have our aorta, pulmonic, NURS, tricuspid, and mitral valve. While the patient is in supine, we will be moving on to the abdominal portion of the exam, where we'll be assessing for symmetry and contour. We're going to keep his shirt covered for privacy purposes. Then we will auscultate for our arteries within the abdominal region using the bell of our stethoscope. In the middle, we will have our aorta. Then we'll have our renal arteries, our iliac arteries, and then our femoral arteries. Next, we will listen for bowel sounds in all four quadrants. We have our right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Now we are going to palpate lightly for any masses or tenderness in the same series. And then we'll deeply palpate for any masses or tenderness. Now we are going to percuss for tympany, dullness, and flatness in all four quadrants. Now we're going to palpate for the spleen. I'm going to put my hand underneath your rib cage. Take a deep breath in. Palpate should be non-palpable for the spleen. And then on this side, we're going to have the patient take a deep breath in, and we're going to palpate for the liver for any enlargement. Next, we're going to have the patient turn towards the back of the room, and we're going to percuss for CBA tenderness. All right, I'm going to have the patient turn back around. And I need to go back to the neck portion of the exam where we will palpate the carotid arteries. And then we will also listen to the carotid arteries for any bruits. Turn your head this way, hold your breath. All right, other side. And I'm going to flip it over and do it with the bell as well. And then other side. Good. Now we are going to move on to the musculoskeletal portion of this exam, where we'll be examining the hands, fingers, wrists, elbows, and shoulders. We're going to be looking for any swelling, redness, warmth, skin integrity. We're also going to be looking for deformities, symmetry, crepitus, tenderness, and nodules and any edema. And we're going to palpate for all of this. Now we're going to palpate for capillary flow. Bilaterally should be less than 3 seconds. And then palpate radial arteries bilaterally. All right. Now we're going to do some range of motion in our fingers. Hold your hands out. We've got flex, extend, hyperextend, abduction, adduction, and then thumb to finger opposition. Now we are going to do our wrist. We'll flex, extend, hyperextend, ulnar deviate, radial deviate, and rotation. Now with our elbows, we will flex, extend, hyperextend, and then our shoulders will flex, extend, hyperextend, abduction, adduction, internal and external rotation, and circumduction. Now we're going to be assessing for strength bilaterally. Can you squeeze my hands? 5 out of 5. Now we're going to assess the bicep and tricep flex and extend. Can you hold your elbows up? Push me away. Pull me in for 5 out of 5. And then we're going to do shoulder with abduction and adduction. So can you push me out for adduction and then pull me in for adduction. Now we're going to assess cranial nerve 11, where we will have, which is a spinal accessory nerve, where we will have the patient shrug against resistant for 5 out of 5. Next, we will be moving on to our cerebral coordination with rapid movement. So if you'll close your eyes and just do your fingers in a series back and forth. Okay. Now we're going to have you do your hand flip-flop. So we'll start out slow and then pick your speed up. And then the next one, you're going to take one finger and then hit mine, and then again, and then again, and then the other side, and then again, All right. Next, we're going to be assessing for stereognosis. Can you close your eyes for me? Hold out your hands. Can you tell me what's in that one?
Paperclip.
And then what's in that one?
Key.
All right. Now we're going to do graphesthesia. Can you hold out your hands again? Palms up. Tell me what I just drew.
8.
And then what I draw.
The letter I.
All right. Next, we're going to do light to dull touch for sensory. You can open your eyes now. All right. Tell me.
Sharp, dull, sharp, sharp, dull, dull, sharp, sharp, dull, sharp, dull, sharp.
All right. Now we're going to move on to assess for vibratory sensation over his proximal ulnar prominence first. Just tell me if you feel this.
Yes.
And then if you feel this.
Yes.
All right. And we're also going to be assessing that over his medial myalysis. Can you feel it?
Yes.
Okay. Can you feel it?
Yes.
Okay. Next, we're going to be assessing for his deep tendon reflexes. First, we're going to start off with our brachioradialysis. We'll do this bilaterally. And then our biceps, so just kind of, okay. And then our triceps, we're just going to do right here. And then right here. Our plantars. And then our Achilles. And then while we're down here, we're going to be assessing for Babinski's by drawing a J underneath the patient's foot. Okay. Next, we're going to be moving on to the lower extremity portion of this exam, where we'll be assessing again for any deformities, symmetry, tenderness, masses, nodules, swelling, redness, or edema in skin integrity. And then we'll palpate for any nodules or masses or anything. Now we're going to be assessing for cap refill in his toes. And then we're going to assess for his dorsal pedal pulses. And now we're going to assess for his posterior tibial pulses. Now we're going to do some range of motion in your toes. So can you curl them under, out, and then up, and then abduction and adduction. All right, and then our ankles will flex, extend, hyperextend, inversion, eversion, and then rotation or rotation. And then now we're going to do our strength while the patient is setting. So we're going to do dorsal plantar flex and extend for strength. Pull me up, push me down for 5 out of 5. Now we're going to do the knees for flex and extend strength. Push me, now pull me. And now we're going to be doing abduction and adduction of the hips. So push me away for abduction, pull me in for adduction. Now we're going to have the patient stand up so we can assess for range of motion in his knees. So we'll flex, extend, hyperextend, flex, extend, hyperextend. And then now we're going to do hips. So we'll flex, extend, hyperextend, adduction, abduction, internal rotation, external rotation, circumduction. On the other side, we have flex, extend, hyperextend, adduction or abduction, adduction, internal rotation, external rotation, and circumduction. Now we're going to have the patient come here and turn around. Bend over. We're going to be assessing for his, spine for his curvature, alignment, any scoliosis, and palpating for any tenderness or masses. Stand up. Now we're going to do lumbar range of motion, where we will flex, extend, hyperextend, and then we'll do lateral rotation, and then we'll do rotation. Now we're going to do the cervical range of motion where we'll flex, extend, hyperextend, lateral flexation, and rotation. We also need to go back to lumbar and do lateral flexation. Now we're going to do Rumbar's test, where we'll have the patient stand with his eyes closed, arms down to your side. And we're looking for any swaying, none noted. Now we're going to have the patient walk regularly to the couch and then do heel to toe for tangtum back. All right, and now we're going to hop on one foot and hop on the other, and this concludes our exam.